smoking, I think that that's like their.
Do y'all hear what he's saying? I suggest you do. This is why it was a lot more lean at first, especially before being undiagnosed and how it was spread, why it was more prevalent in the male gay community. Because of the fact that most engage in anal sex. And it's a lot easier for it to spread that way due to the skin integrity being compromised. With vaginal sex, again, generally, less tearing, less exposure to actual body fluids into the bloodstream due to your own, and we talked about this. You have innate immunity, right? Vaginal secretion, skin, acidity. This helps prevent a lot of it. But when having anal sex, all of those barriers are not really present. So you're more susceptible to becoming infected. Make sense?
Yes.
Yes.
So when you started reading like what HIV is, it says that it's transmitted blood, but they can have blood transfusions. Like how does that work?
So
You mean get blood?
let's start from the beginning. So it says blood transfusion is a risk factor. So people with HIV can receive blood transfusions, but should they donate blood?
No.
They do not. Now, should you not know that you have HIV and you donate blood, all blood in the US goes through an extreme screening process. It also still has to be treated because blood is not just taken from one person, by the way, and just given to you. There's a whole process and treatment that goes into it to decrease the amounts of rejection from the next person. Because the more factors are present, the more likely the next person that receives it can reject or have a transfusion reaction. So it doesn't just get bagged up and then sent off. There's a whole process that goes into it. The test for hepatitis C, HIV are more prominent bloodborne infections. It doesn't just get given. Hence, not a significant problem in the US. Yes.
What about like two HIV patients? Theoretically, like, do they give to each other? Like,
At that point, if you really have no option, it is just a thing. Now, should that process probably be present? Probably never, at least not in mainstream cities or again in the US, since you have a blood bank supply. How it is, and I think I mentioned this to y'all, is with organ transplants. People with HIV and hepatitis C can donate organs. Now, this will involve the big significant risk and probability that you will develop, right, you're gonna become infected. But, and I give this example, when learning about organ transplants, there was a lady who came in, she had had 3 kidney transplants in her life, and I think on her second one, the patient was exposed to or have known to be to Hep C, hepatitis C. She still took the organ, okay? Because, again, HIV and hepatitis C may be managed. Hepatitis C is from the initial to the end might take 20 to 30 years. HIV can be managed for the rest of your life. So if someone has a liver problem, right, liver cancer, you got months, at best, a little over a year. So, take HIV and some medication, or do you want to die before Christmas? This is a this is a real situation. So, if you give the offer, no one's gonna just give it to you. Obviously, it's clearly stated, hey, this liver is from, listen up, ladies to the side. This is obviously something that's stated to patients. It's not just random. Okay, not like I hope they don't have anything, right? Always with organ transplantation, everything is looked at, is tested. You have obviously a say in it. And even if it's overlooked, that's why you sign a informed consent. These are still real risks.
even if it was like persons that just not so diagnosed, right?
They can have asymptomatic. What if they just don't know? What if they just happen to? So this is all, and that's why hence you have an informed consent. Unlikely, but not impossible. Okay, are we good with risk factors? Please know your risk factors. Okay, all of them. Okay, Expected findings. So what will you experience when you become infected? Chills, rash, anorexia, nausea, weight loss, right? Like this loss of appetite. Weakness, fatigue. Headache, sore throat. Night sweats. Okay? CBC and differential are taken, but the way to do this is to actually diagnose, and you'll see the labs there, diagnostic procedures, a positive result from an ELISA or EIA. So let's go. Now it's also called, right, an EIA. It says a positive result confirmed by a positive Western blot. So if this is positive, then you move to a Western blot. This confirms the diagnosis. This is screening. Okay. Home test kits are also available using a drop of blood. There's also saliva swabs, less reliable. Okay. Plan to have a positive result from a confirmatory test such as the Western blot should then be tested for viral load. Then you have the next test. You have their HIV quantification. You can think of quantity. Quantification. This is your viral load. How much virus you have. So as I say, quantification, then quantity. Then you have a HIV genotype or tropism. This is to show drug resistance. Okay, those are the three that you need to be familiar with. What time is it? Okay. Nursing care. Look at what we're gonna do. Collect data on sexual practices. Fluid and intake, so I and O. Their nutrition, because they're prone to wasting away, especially if untreated. Skin integrity, lung sounds. Okay, check for any neuro, such as confusion, as they can develop HIV-related encephalopathy. Okay, skin care, we put skin integrity and analgesia for any pain. Now, I won't test you on the medication like that, but I have seen it come up. So I'm being very straightforward, explicit with you, that they've seen them come up in ATI with either how does this medication work, meaning like what point of the replication does it interrupt, or what are like side effects or risks of the medication. So I don't test you on it, but it's not on, like I always see at least one or two of them come up during your med surg proctor. So if the medication is something you should be wary about. Okay?
Question. So if someone is, has a judgment in control, do they take most? Is it like, do they take 1 or 2, or is it like most? Cause it's like all different stages.
So I think it depends on what kind and like just what medication is being, because again, there's different strains of HIV. So medication will vary based on that. So if we read through it, it says highly active antiviral therapy. This is something you should know. It's called HIIT as well. Sorry, highly active is an A there. Highly active antiviral therapy. I'm gonna look up the name. It's HIAT, things like that. It's like an intense amount of it. Highly active. HAIRT is what it is, right? HAART. Active antiretroviral therapy, HART. Okay? Involves using 3 to 4 meds in combination. And this is to prevent resistance. Now, nowadays, the reason why you also hear though, that people take only 1 or 2 pills, is that a lot of these pills contain 2 to 3 medications each. So that way, they only take 1 pill, and it's providing the full therapy. Make sense? Okay. So with that, depending on what stage they're at, what kind of resistance the virus has, that will decide which medication they take and how many.
Like it looks like it's like the more severe, like the first one just stops it from going in and then prevents it from getting worse.
Okay. Client education, or on in the complications. Okay, let's go on break and I'll write out the important stuff for y'all and then just review it.